Hi, my name is Brittany Deer. I'm a fourth semester nursing student, and today's date is November 2nd, 2018, and the time is approximately 2 o'clock in the evening. Today I'll be administering insulin, and I've already double-checked my physician's orders. I have checked my patient's last blood glucose levels, and then I'm walking into the patient's room, performing hand hygiene. I'm going to don on gloves, check my two patient identifiers. I'm going to explain to the patient what I'm doing, why I'm doing it, and what they can do to help. And then I've already done my 3 med checks with my insulin. So moving on, we've already established a skin site. It's going to be the abdomen. So I'm going to go ahead and get my first order, which is 5 units of Novolog and the insulin pen ready. I'm going to roll the insulin pen 10 to 15 times. After that's done, I'm going to take the cap off. I'm going to clean the tip before putting on the needle, the needle. I'm going to put on the needle, make sure it's secured. And I'm going to prime to 2, as you can see. And then I'm going to go ahead and prime that. And then I'm going to prime to 5, which is the order. Walking over to the patient, I'm going to keep the cap on. And I'm going to clean my patient's skin. Waiting until it dries. Not fanning it, just waiting until it dries. Take off the needle. I'm going to pinch the patient's skin. I'm going to warn them that they're going to feel a poke. Go at a 90-degree angle. And then administer the 5 units. Staying in the patient's skin about 10 to 15 seconds to ensure that they got it all. After that, I'm going to cap the insulin pen, and then I'm going to dispose of the needle in my sharps container. Well, it would be in my sharps container, I'm sorry. After that, I'm going to clean the tip again, and then I'm going to go ahead and put this in a safe place. So now I have an order of 4 units of regular and 8 units of intermediate. So I'm going to go ahead and clean the top of those. And then I have my insulin needle here. I'm first going to, it's supposed to be clear before cloudy, but when drawing up, I'm going to draw up my intermediate first and then my cloudy. So the order says 8 units of intermediate, so I'm going to draw back 8 units of air, then administer that. Okay. And then I would take that back out, go ahead and cap my needle again, and then draw up 4 units of air, go into my clear, administer, flip it over and draw back 4, making sure that I have all the bubbles out. Okay, and then I'm going to keep the needle in the vial, and I'm going to go ahead and check with another nurse, and that is my 4 units of regular. Okay, taking this back out, I'm going to cap it, and I'm going to walk over, and I have my intermediate. Okay, and then I want to draw back 8, which would be a total of 12. Okay, ensuring that I don't have any bubbles or anything like that. I'm going to keep my needle in my vial and double check with another nurse, and it should equal 12. Taking my needle back out, I'm going to cap it for the safety of me and my patient. And then I'm going to walk over to my patient. We're going to clean a different site than the previous site that we administered the Novolog. And then we're going to clean the skin. I'm going to pinch the skin, I'm going to warn the patient they're going to feel a poke, going at a 90-degree angle. I'm going to administer the 12 units. Unlike the pen, we don't have to wait 10 to 15 seconds, but whatever safety mechanism that your needle has, go ahead and do that now. I'm going to go ahead and cap my needle, and then I'm going to go ahead and dispose of it in the sharps. I would make sure the patient is okay, and I would then check their next blood glucose level at the scheduled time, and then I would go document. Thank you.